Understanding the remission and relapse cycle in Crohn's disease. Crohn's disease causes irritation and swelling in the lining of the digestive tract, also called the gastrointestinal tract or GI tract. Inflammation from Crohn's disease can happen anywhere along the digestive tract. It most commonly affects the end of the small intestine and the beginning of the large intestine. Crohn's is a chronic condition, so most people will experience symptoms on and off throughout their life. Periods when symptoms appear are called relapses. Symptom-free periods are called remissions. Keep watching to learn more about Crohn's disease remission and relapse cycle. What is Crohn's disease remission? The main goal of Crohn's disease treatment is to achieve and maintain remission. This is when symptoms improve or disappear entirely. Doctors have different definitions for remission and different ways to describe it. Remission can mean different things based on the parameters used to describe it. Types of remission include clinical remission. This is the term your doctor will typically use to describe your remission. It means your symptoms have improved or gone away, yet you may still have inflammation in your GI tract. Endoscopic remission. This means there's no evidence of inflammation on tests like a colonoscopy or a sigmoidoscopy. This type of remission is harder to achieve than clinical remission, but it's the goal of treatment because it means the damage to your GI tract is stopped. Radiographic remission. There's no sign of inflammation on an MRI scan or other imaging scans of your GI tract. Histological remission. Though there's no agreed-upon definition for this type of remission, it generally refers to reduced inflammation and healing in the lining of the GI tract. With histological remission, there's no evidence of inflammation when tissue samples are studied under a microscope. Normal markers of inflammation. Blood and fecal tests show no signs of inflammation. Symptoms. Symptoms like belly pain, diarrhea, and bloody stools should get milder or disappear once you're in remission. Duration. Periods of remission can last anywhere from a few months to several years. Symptoms usually come back at some point. Maintaining remission. Diet. A few diets have been suggested for maintaining remission. Gluten-free diet. Gluten is a protein found in grains like wheat, barley, and rye. Some people with Crohn's disease find that cutting gluten out of their diet helps with symptoms. Low-fiber diet. Cutting back on high-fiber foods like whole grains, nuts, and popcorn may relieve symptoms like belly pain and loose bowel movements. Low Fodmap diet. Fodmap is shorthand for 5 sugars that your intestines may not absorb well. You'll find them in foods that contain natural sugars like sorbitol and xylitol, as well as in chickpeas, lentils, garlic, and wheat. Low red processed meats diet. Some people find that when they cut back on beef and other red meat, as well as lunch meat, hot dogs, and bacon, they don't get as many flare-ups. Mediterranean diet. This diet is high in fruits, vegetables, fish, olive oil, and low-fat dairy. It's low in red meat. Specific carbohydrate diet. This diet cuts out certain sugars, as well as fiber and some grains. So far, none of these diets have been proven to maintain remission, but they may work for certain people. Talk with your doctor or a dietitian before changing the way you eat. Treatment. Being in remission doesn't mean that you should stop treatment. Continuing to take your medication can help prevent a new flare of symptoms as well as complications. Drugs used to maintain remission include aminosalicylates, 5-ASAs, like sulfasalazine. These drugs block certain pathways to bring down inflammation in the lining of the intestine. Immunomodulators, such as azathioprine. These drugs reduce the immune system response to stop inflammation. You may get one of these medications if the aminosalicylates don't work for you. Biologic drugs. This newer group of drugs target certain proteins in your body that cause inflammation. Biologics come as an injection or infusion you get under your skin. Other tips for maintaining remission. Certain factors tend to trigger flare-ups. Here are a few things you can do to avoid a return of your symptoms. Manage stress. Stressful situations or strong emotions can lead to flare-ups. It's impossible to eliminate all stress-producing events in your life, but you can use relaxation techniques like deep breathing and meditation to change the way your body reacts to stressful situations. Avoid non-steroidal anti-inflammatory drugs, NSAIDs. Some commonly used medications, including aspirin, naproxen, Aleve, and ibuprofen, Motrin or Advil, are possible triggers for flares. Limit antibiotics. Using antibiotics can cause changes in the bacteria that normally live in the intestine. This can lead to inflammation and symptom flares in some people with Crohn's. If you smoke, consider quitting. People who smoke tend to have more flares than non-smokers. If you smoke and are having trouble quitting, reach out to your doctor for help. Watch your diet for triggers. Some people have diet-related triggers. No one type of food aggravates symptoms in everyone with Crohn's. Keeping a food diary to identify any potential triggers can help you better understand how your diet relates to your symptoms. What is Crohn's disease relapse? Even with treatment, people with Crohn's disease will likely experience flare-ups, or periods of time when their disease symptoms are active. It's not always possible to know what causes a flare. Flares can happen even when you're taking your medications as prescribed and following self-care practices. Symptoms. Symptoms of a relapse can vary from mild cramping and diarrhea to severe abdominal pain or bowel blockages. You may experience these same types of digestive problems you had when you were first diagnosed, or you may have new symptoms. Typical symptoms during a flare include diarrhea, frequent bowel movements, blood in the stool, belly pain, nausea and vomiting, and weight loss. Duration. Symptom flare-ups can last from weeks to months. Flare-ups can happen naturally when Crohn's is untreated. They can also happen when Crohn's doesn't respond to treatments and symptoms remain acute. Treating Crohn's disease. There are two main types of treatment for Crohn's disease: medications and surgery. Medications. Most Crohn's disease medications are meant to reduce inflammation in the GI tract. Some medications treat flares, while others help keep Crohn's in remission once symptoms have gone away. The most common drugs used to treat Crohn's include aminosalicylates. These medications help bring down inflammation. They work well for mild to moderate disease and to prevent relapses. They're most effective for Crohn's disease that's in the colon. Corticosteroids. These are powerful anti-inflammatory drugs. They help manage flares, but are meant to be used only short-term because of the risk of side effects like weight gain, mood changes, and weakened bones. Immunomodulators. These drugs dampen the immune system response to bring down inflammation. Your doctor may recommend one of these drugs if aminosalicylates don't work for you. Biologics. Biologics target proteins in your body that cause inflammation. They come as an injection or infusion you get under the skin. Antibiotics. These medications help prevent and treat infections in the GI tract. They're used to primarily treat infections that may be causing further complications. Surgery. Surgery is an option, but it's usually reserved for Crohn's disease that doesn't improve with medication or stops responding to it. Up to 75% of people with Crohn's disease will eventually need surgery. Surgery can be used to open a part of the intestine that's become blocked. It can also be used to remove a damaged portion of the intestine. Here are some types of surgery to treat Crohn's disease. Resection removes only the damaged section of intestine. Proctocolectomy removes the damaged colon and rectum. Colectomy removes the colon. Fistula removal treats an abnormal tunnel that forms between two areas of the intestine, or between the intestine and another organ like the rectum and vagina. Abscess drainage removes an abnormal collection of pus that's built up in the belly. Strictureplasty widens a narrow or blocked part of the intestine. Surgery doesn't cure Crohn's disease, but it can relieve symptoms and help improve quality of life. The takeaway: Crohn's disease can be unpredictable, and it's not the same for everyone. Your relapse and remission cycle will vary depending on your symptoms and triggers. It will also depend on how well your Crohn's responds to particular treatments. Working with your doctor to prevent relapses and managing them when they do happen can help you to stay on top of your condition. The world is filled with stories going viral every single day. But how many of these sites can you actually follow? We understand that your day should start with positive stories, stories that resonate with you. And so we started JoJo Stories. Our mission is to create meaningful stories that cover everything from animals to anthropology, history to environment and lifestyle. The kind of content you read on our site will be one you'll want to share with your family and friends. We hope you'll join our growing family and be part of our community. Welcome to JoJo Stories. JoJoStories.com.